Thank you for the introduction. What I'd like to talk to you about today is science of Invisalign G5, the biomechanics of Invisalign G5. If you recall, the clinical innovations through the past years from 2009 on through 2011 were feature sets improving treatment outcome with Invisalign. In 2013, we introduced a new material. Now in 2014, I introduced to you Invisalign G5, Innovations for Deep Bite, the Biomechanics. Invisalign G5 is a series of features. They're innovations in treating deep bites. They're engineered to help improve the clinical outcomes in deep bite treatment. All of the innovations through past years is to improve clinical outcome. So, what is G5? SmartForce features. They're designed to improve control of the anterior intrusion and premolar extrusion when treating deep bites. We'll talk about the science, the mechanics. How do we actually accomplish that with the aligner itself? We also have precision bite ramps, and they're designed to disocclude the posterior teeth, which is beneficial in terms of treating deep bites as well. During the panel discussion, the doctors will talk how these features and these sets actually can be used to get better treatment outcomes when treating deep bite cases. So, features. What do we address? If you believe that programming an aligner for intrusion on a single tooth produces a force through the apex of the tooth, does it? We actually measured it on our benchtop equipment, and as we determined, it does not produce a force through the apex of the tooth nor through the center of resistance. It actually produces a force that's over at about 45 degrees or so, as you see in the diagram, the red. So this is not that effective in producing intrusion of a single tooth. So our feature set is to address the improvement of that direction. Can we get the force through the apex of the tooth? What we've done, we produced a pressure area. And you see the diagram on the top right introduces a pressure area which concentrates force on the lingual aspect of the tooth to counteract the lingual force that was being produced by the aligner. What we now do, if you look at the diagram on the bottom left, notice that the red vector is now improved, greatly improved, and nearly through the apex of the tooth. We anticipate that the white force produced by the pressure point will produce the red vector and give you more effective intrusion of a single tooth for anterior intrusion. Now, if we have one tooth for intrusion, this does not treat a deep bite case. So we need to treat all anterior teeth. If we took the same solution and we port that to the other three teeth, does it produce a correct force system to intrude all four teeth? No, it doesn't. So what we actually did was we changed the activations. We balanced the forces in the anterior. And if you look at the diagram on the bottom right, with the new pressure areas that we have on all four of the anterior teeth, all four teeth receive equivalent force and now will be intruded as a group. A unit will intrude. Now, according to Newton's third law, if you have an action, there must be a reaction, an equivalent reaction. So if we're intruding the anterior teeth, we'll get extrusive forces of equivalence on the posterior dentition. The diagram on the left makes that fairly clear. So we do recognize that if you try to intrude the anterior teeth, when you go to insert the aligner, it'll have a tendency from the reaction forces to disengage from the posterior dentition. So in the field for many years, people have wondered, what is the proper retention requirement? Do I use a retention attachment on the bicuspid, on the second bicuspid? Is it on the first molar? What do you do? Our measurement equipment has indicated that a bicuspid attachment for deep bite on both bicuspids bilaterally is sufficient to support anterior intrusion. It's also possible that in the lower arch, as you're intruding the anterior teeth, you wish to level the curve of Spee. If you do, we can actually pass those reaction forces to the two bicuspids, and if it's necessary to extrude them, to activate them further so they get proper extrusive force, thereby extruding the bicuspids, intruding the lower anterior teeth, leveling the curve of Spee for effective deep bite treatment. So the bicuspids can be extruded if it's required in the treatment. This would actually be evident in the ClinCheck that you approve. If the bicuspids are extruding, they will actually get activation for extrusion. Deep bite attachments for extrusion are activated to deliver the extrusive force that's necessary. To extrude teeth, we only need about 30 grams of force. We've designed these attachments so that they produce approximately that intraorally. So controlling the delivery of the reaction forces, that's what makes for better, more predictable treatment. Doctors treat with actions and reactions, anterior versus posterior. That's what's being controlled in the aligner with the biomechanical approach that we've taken. Another aspect to the G5 innovations is precision bite ramps. So I'll talk a little bit about the precision bite ramps now. The main guide for this is to disocclude the posterior teeth. Clinicians believe that in disoccluding the teeth, you have an unopposed eruption that's possible. Perhaps the movement of those teeth is not impeded. The goal is to disocclude the posterior teeth. What we've actually done is position bite ramps on the anterior teeth to produce contacts. Now, there is a conventional bite ramp which exists today that many doctors have used. They actually believe it disoccludes the posterior teeth and perhaps produces other forces on the anterior group. The doctors in the session will actually talk about what their beliefs are and how they affect this clinically. The differences between the conventional and what we're now introducing in Invisalign G5, the new bite ramp is positioned to create premature contact on the opposing tooth. Each bite ramp has a different level to it. It's dependent upon the opposing tooth position. The size and shape is determined specific to the tooth. This is patient-specific treatment. This is something that's very new in orthodontics this way, specific tooth by tooth with aligners. Also, the bite ramps they're repositioned aligner by aligner throughout the stage of treatment. As the teeth are leveling, as they're intruding, the position of the bite ramp is changing. We can determine this in the software and fabricate the aligner such that it has this. This is quite an improvement. So, the positioning of the bite ramps, how large can they actually be? In the field, people have wondered for years, can we build a 1 millimeter bite ramp or 2? How large can it actually support the forces from the mandible? Significant overjet can be accommodated. The sagittal prominence that we've measured is possible up to 3 millimeter and can support bite load quite well. Now, what we talked about in the first part was about precision optimized attachments. And in those, it's balancing the forces within one arch. When you look at a bite ramp, the action and the reaction is from the maxilla to the mandible. The reaction is being produced by the forces from the muscle of the mandible. So in summary, Invisalign G5 innovations for deep bite. We have SmartForce features that are designed to improve control of anterior intrusion and the premolar extrusion. And we have precision bite ramps that are designed to disocclude the posterior teeth.